Hello, everyone. You're welcome to today's class. Thank you for dropping by at my handle, and thank you for sharing past videos, and also thank you for taking time out to enjoy these lectures. Thank you for also liking and subscribing to my YouTube channel, and I think that it's really encouraging to see that a lot of you love these lectures, and I believe it's been doing you a lot of good, bringing clarity and understanding to aspects of public health. Thank you very much. Today we want to talk about logistics management system in health sector. Logistics management systems in health sector. And this particular video will be in series. It will be in series, 6 series as a matter of fact. My name is Dr. Henry Aisaboy. This is the part 1. Under the part 1, we will be looking at principles of logistics management. We will be looking at issues facing the logistics system and the logistics management system and key elements. Under the part 2, we'll be looking at essential data collected on the Logistic Management Information System, known as LMS. We'll also be looking at basic elements of inventory management in the information system, inventory control and purpose. We'll be looking at, under the part 3, principles of procurement, product selection, forecasting and quantification. Under the part 4, we'll be looking at commodity security, health facility, equipment, and basic issues. We'll also be looking at history of equipment and legal issues. Now, under the part 5, we'll be looking at memorandum of understanding and legal documentation. We'll also be looking at routine maintenance. We'll also discuss planned preventive maintenance. Under the part 6, we'll be looking at equipment disposal factors, procedure for equipment disposal, standards for equipment disposal, and then we'll look at the conclusion, recommended exercises, and that will be all. Now we proceed to the part 1. And so I want to welcome you to the topic, logistic management systems in the health sector. Once again, I am Dr. Henry Aisaboy. In today's lecture, which is the part 1, we will be exploring the principles of logistics management and the common issues facing the system, facing logistics system, and the key elements that make up an effective logistics management system. By the end of this session, I believe that you should understand how logistics directly influences healthcare outcomes. Because in public health, a delay in logistics is often a delay in saving lives. Now let's look at the principles of logistics management system. Here we see, or let me begin by saying that we'll start by defining what logistics management means in healthcare. Logistic management is the structured process of planning, implementing, and also controlling, as you can see on your screen, in controlling the efficient flow of health goods and services from the point of origin to the point of consumption. If you look at this in simple terms, it simply ensures that the right product reaches the right place. And not just reaches the right place, it should reach there in the right quantity, and it should arrive at the right time, and also at the right cost. So take note of these simple words, which are key, very critical to proper definition of this course or this logistics management as a definition. The right product, reaching the right place in the right quantity, and at the right time, and at the right cost. The goal is to meet the needs of patients and healthcare providers in a cost-effective and timely way. And in doing this, it is compulsory that we maintain quality and reducing wastage. So, if you pull this together, you will see that logistics management system is critical to the health care. Now, let's look at the key principles that guide this process. The key principles that guide this process. This is just an overview of the logistics management in some, environment or workplace or logistics house. And from here, you can also see different labels. For example, all this has to do with logistics, repackaging, inventory, healthcare, innovation, supply, logistics chain, hospital, data, practices, and many others. All these are part of what retailing, comparing, acquisition, and all that. So from time to time, you see us use these terminologies. So let us see the key principles one by one. You can use a short formula known as CREF so that you can remember them. C for coordination, R for responsiveness, E for efficiency, and F for flow control. Let's begin with flow control. Think of this as the heartbeat of the logistics system. It ensures that goods, services, and information move seamlessly through the system. For example, when vaccines are dispatched from a national store to a local health center, effective flow control ensures they don't get delayed or damaged along the way. Number 2 is efficiency. Efficiency here simply means using minimal resources to achieve maximum results. In logistics, it's about minimizing waste, fuel waste, time waste, and storage waste, and maximizing output so that every naira, every capital spent adds value to healthcare delivery. Let's look at coordination. No logistics system can work in isolation. Coordination integrates various activities, such like your procurement, transportation, warehousing, and distribution, as you can see on the pictorial diagram there. All this is to ensure synergy. For instance, when the procurement unit fails to communicate delivery timelines with the warehouse, delays and stockouts are inevitable because of the lack of information. Let's move to the fourth one, responsiveness. This means adapting quickly to change. During emergencies like epidemic or natural disaster, a responsive logistics system adjusts quickly to meet sudden demands. A good example is how supply chains were restructured during the COVID-19 pandemic to be able to meet oxygen and PPE needs. That is the personal protective equipment that were needed. They weren't available at the start, but we could see that proactiveness, that responsiveness. Quickly, a lot of hospitals, their logistics swung into action, and they were able to restructure their supply chains so that they could meet the very critical needs like oxygens and the need for gloves, nose mask, and so many other things. So remember, flow control, efficiency, coordination, and responsiveness. These 4 principles are the foundation of every successful logistics system. Let's look at the next topic under part 1, issues facing the logistics system. Now, even with strong principles, logistics systems face many challenges, especially in low and middle income countries. Let's discuss some common ones. Number one, inadequate infrastructure. Inadequate infrastructure. When we say inadequate infrastructure, you can think of poor roads, limited cold chain capacities, and unreliable transport networks. All these often cause major disruptions. Imagine a rural hospital unable to deliver vaccines on time because the vehicle broke down or the ice packs melted. That delay can actually cost lives. Number two, forecasting challenges. That is another issue. Forecasting determines how much of an item to order. But when there's a pandemic or sudden outbreak, demand becomes unpredictable. For example, during COVID-19, many hospitals ran out of oxygen tanks because no one anticipated such, an extreme surge could take place. No one anticipated it. Number three, let's see the lack of trained personnel. The lack of trained personnel. That's another major issue that faces the logistics system. And you know that without skilled staff who understand inventory systems, mistakes will happen, such as overstocking or stockouts. Therefore, training is key to build a resilient logistic chain. Number four is policy compliance. Government procurement policies often change, and when they do, they can delay the entire process. So you may have all the funds available, but if the policy changes mid-procurement, the system will halt to stall. There are also more issues in healthcare logistics. And what are those issues? You have the stockouts and overstocking. The stockouts and overstocking. Under the stockouts and overstocking, these are twin problems. When stockouts happen, patients suffer. When overstocking happens, the facility wastes money and storage space. The other is storage problems. Some facilities lack proper storage conditions for drugs requiring temperature control, and this is a serious issue. You also have the pilferage and deterioration. Pilferage and deterioration. And this is where inadequate monitoring can lead to theft or damage of supply. Sometimes this drug expires simply because no one noticed that they were at the back of the shelf. You also have other challenges, such like obsolete items and transportation delays. Obsolete items and transportation delays. Some hospitals keep equipment or reagents that have expired or become outdated. And transportation issues also, such as fuel scarcity or vehicle breakdowns, further compound delays. Another issue is the supplier dependence. Supplier dependence. Relying on a single supplier is risky. If that supplier fails, the entire system collapses. So diversification of suppliers is therefore essential. I like to emphasize that these challenges are not theoretical. They are real. Many public health programs have failed simply because logistics was ignored. That's why, as future health managers, you must see logistics as the engine room of public health delivery. This is critical and very important. We'll move to the next slide now. Logistics management system and key elements. Now, let's move on to the core elements that make a logistics management information system functional. The LMS integrates data and operations to ensure that health commodities flow smoothly from suppliers to service delivery points. And here are the key components that you must understand. Tendering and procurement, storage and classification, distribution, codification, transportation, and security and disposal. We will begin by looking at tendering and procurement. This is where it all begins. Selecting vendors, evaluating bids, negotiating prices, and purchasing items. A transparent and accountable procurement process ensures quality and cost effectiveness. Number 2, storage and classification. Once items are procured, they must be received. They must be inspected and must be properly stored. In terms of classification, such as coding items into categories, this will help to reduce confusion and it will help to reduce loss. For example, separating reagents from consumables or sterile from non-sterile items. The other part is distribution. Remember, we are looking at the key elements now under the logistic management system. The other part, number 3, is distribution. This is the process of moving items to the points of use. Distribution must be timely and organized to avoid delays that can affect healthcare delivery. So, you don't joke with your distribution. You must ensure that it is timely and proper organization must have been put into it so that delay does not happen at all. Number 4 is codification. This means assigning unique codes to items for easy identification and tracking. Now you think of it like giving every drug or reagent a fingerprint in the system so that with that code, every drug can easily be seen, spotted, or recognized. Number 5 is transportation. This involves coordinating the movement of goods from central warehouse to regional depots and eventually to the health facilities that needs them. Therefore, proper planning here ensures that reliability is put in place and also cost is saved. Number 6 is security and disposal. Security and disposal. Finally, protecting stored items and disposing of expired or obsolete ones responsibly is key because of safety. And also, it is key to compliance with regulations. Because you don't just dispose things anyhow. You must ensure that expired stuffs or obsolete ones are disposed responsibly according to regulations. When all these elements function together, procurement, storage distribution, codification, transport and disposal, we achieve a functional, transparent and accountable logistics system. As a mini recap, I just want to summarize this part one, because I believe that this part one has taught us that logistics management is about efficient flow and control of health commodities. It faces real challenges such as poor infrastructure, forecasting errors, and policy issues. And it succeeds only when key elements such like procurement, storage, transport, and disposal work together in harmony. In closing for this part one, I'd like to let us know that in our next lecture, where we'll be looking at part two, we will go deeper into the data that drives the Logistics Management Information System, LMS, and explore how inventory management and control help us maintain balance in the system. In fact, the part two will focus on essential data collected in LMS, the basic elements of inventory management, inventory control, and its purpose. So, stay tuned, take your notes, and reflect on how logistics connects every pillar of public health practice. We have just come to the end of part one of the series on Logistic Management Information System. Logistic Management System in the health sector. And so if you enjoyed this video, take time to like it, subscribe, and also you can share with your friends. I'll see you in part two of this lecture series. Thank you.